Hello and welcome to Health Innovators. I'm Jonah Comstock, Editor-in-Chief at Pharma Forum. I'm here at Health 22 in Las Vegas, and I'm here with Manny Montalvo.
Montalvo.
Montalvo, easy enough.
That was very good.
I'm here with Manny Montalvo, the SVP of Digital Health at Teva Therapeutics.
Teva.
Right? Teva. Okay. I never know. It's like buy or bear.
Teva, Teva, right? Yeah.
Yeah. You guys have a couple of announcements at the show, working with a couple of different remote patient monitoring startups around your Digihaler product, right?
That's correct. Actually, we're pretty excited about it. So just as a step back, we have a division of folks that are passionate about technology, passionate about asthma. And our vision is to be able to create a unit that one day can really revolutionize the way we look at healthcare. And more importantly, by being able to prevent and predict an asthma attack from ever happening. That's our sole goal. That's our mission and why we exist. So today we're announcing two partnerships to help us get closer to that vision with Rimidi Healthcare and HealthSnap, and they're a virtual care company. And so what they do is they integrate into large IDNs using our data to be able to pipe in and be able to do population health.
IDN, just saying. That's
Yep. IDN's an integrated delivery network.
Oh, okay.
So there are about 6,000 hospitals in the US and give or take around 2,000 integrated delivery networks who do population healthcare. And so our platform will enable them to be able to view large patients of asthmatics using our data.
So how has the Digihaler been sort of deployed so far? And how much will this kind of change the reach of the product?
Yep. So like a traditional pharmaceutical company, we have sales reps today that go out in the field and they talk to allergists and pulmonologists, trying to get them comfortable with the software and the device. And so that's very traditional pharma, right? That's you have to call on doctors, educate them, get them to write the prescription. Patient has to go to the pharmacy to pick it up. That's kind of the traditional pharmaceutical model. Why we're excited about the digital space is we can develop a different way to get to customers, and more importantly, put the data back in their hands so they can see and track how their asthma is progressing over time.
So walk me through the patient experience here. What's it like to be a user of this compared to a typical inhaler, and how much different is it? How much does the data affect the experience for the patient?
Yeah, and a traditional mechanical inhaler is what we refer to them. Today you have to go to the doctor writes a prescription, you pick it up at the pharmacy, which is again great. But when you get home, you don't always know when to take the inhaler. And most asthmatics have 2 or 3 inhalers that they're prescribed at a time, typically a rescue medication and a maintenance product that goes with it. With that said, if you think about the end user or the consumer, which one do you take first? How often do you take it? When do I take it? What's my schedule like? I don't even know if the medication is actually reaching where it needs to get to. So that's the typical kind of consumer experience today. And if it doesn't work, then they have to go see the physician again. And then they get prescribed a different inhaler. And the whole cycle begins over and over and over again. With Digihaler, for us, what we're excited about is for the first time, you have software that's integrated into the device. So for the consumer, what's different about it is when you get it, like any technology, you have to go to the App Store, download the app, then you have to create an account, which is again very simple to do. And there's a QR code on the inhaler itself. You take your phone, you scan it, and you're good to go. Pairs automatically and registers all the information. And so for that, why that's important for the consumer is they can actually see their data in real time. So if I take my medication, the system tells me whether the medication got to the right place at the right time. I can see how it's interacting with the other products that I'm taking. And more importantly, what it does is it enables a great conversation to have with the consumer and the physician. So if things aren't working, the doctor can then see, okay, now I understand why it's not working, it's not getting where it needs to get to, or more importantly, you're not complying with the medication. So there's ways for the doctor and the patient to adjust. And again, we believe that the more the patient knows, right, they have more control of their asthma and can have a better dialogue with the physician.
So that's some of the benefit of that data for the patient. What about for the health system, having that data in aggregate, large, or for Teva for that matter? Who has access to it in an aggregated form, and what are the kind of potential benefits of that?
So in an aggregated form, right, we can actually take a look at much more information today about asthmatics than we have in the past. So from a healthcare perspective, if you think about their population, they may have 400,000 asthmatics going through the hospital care system. For them, they want to know which patients are compliant, which patients are taking their medication, which patients are the most at risk to have an exacerbation and end up in the ER, right? So that's how they look at the data. So the data allows them to monitor those patients remotely and potentially intervene before they actually have an attack.
Got it. Got it. So tell me a little bit about how you got connected to these particular startups and what drew you to them in terms of how their business model works working with these IDNs.
Yeah, for us, I think again, traditional pharmaceutical companies. I've worked all my life in traditional pharma. You tend to develop a product, and that product becomes very proprietary. It's yours, right? We're not very good at sharing data and working with partners and others. Um, in the healthcare technology space, you cannot do that because there's integrators, there's people that look at data different ways. And so one of the things we learned early on is if we were serious about this business, we needed to figure out how to partner with technology companies that are already integrated in the hospital care system. And so we have a more of an open source model where we actually want to partner and provide the necessary data to both providers, the payers, the physicians, and ultimately the consumer.
Great. And the benefit for them, of course, is it's another kind of sensor. It's another stream of data that they wouldn't have had about the patient
Yeah,
before.
if you think about the different stakeholders that are in the environment, on the payer side, what they want to do is to put them on medications that cost a lot less than more expensive products. That's their goal, right? Is to help to save the healthcare system resources. On the physician side, you want to make sure that what you're providing to the patient is actually working, and that they have really, really good outcomes, right? That's what you want. So we wanted to make sure that our system spoke to all stakeholders, that everyone can see the data, in order for the patients and physicians to be better informed about healthcare. And it goes back to the earlier comment that I talked about. Why are we here? Why did we do this, right? And really, for us, it was all about how can we prevent an asthma attack from ever happening again? Could we use technology to be able to prevent that? And that's our mission. One day, we believe that with more people on the platform, the AI will get a lot smarter, the machine learning will get a lot smarter, and one day we'll be able to predict an asthma attack from happening.
Right. Yeah. Thanks for spinning back around to that because yeah, that predictive analytics element is of course kind of the holy grail, right? How how what are the ways you're investing in AI and in the technology stack to try to get closer to that goal?
Yeah, so that's a great question, and I think that's why we're here at Health, right? We're meeting other partners that have been doing this for a lot longer than us, so we can learn from them. And so we're investing in our own regulatory staff, our legal staff, our own clinicians, right? Our own programmers, and then where we don't have the capabilities, we'll look to partner with other companies like we've done already.
Great. More broadly, anything interesting you've heard at the show or seen, or what are you thinking about in terms of trends around digital therapeutics and connected delivery systems and those sorts of things that you
Yeah,
think about all the
yeah,
time?
I know it's a great. I was. This is my first health meeting. As I mentioned before, I've been a traditional pharma for a long time. I am very excited to see how many people are investing in the space. And for me, it's really about trying to figure out how we connect the dots. Uh, we were just mentioning earlier today, there are so many different partners who offer so many different things, right? And it's all for better outcomes, better patient value. But I think for us, it's how do we connect all of these different dots, right? So that it's actually meaningful. And to me, that's the most exciting thing about being here is listening to all the different disruptors in the space to figure out, can we partner together, not by being selfish and keeping our own data proprietary, but being more open source. And that's why I'm excited about spending time here.
Great. Thanks so much, Manny.
Thank you.
Great chatting
Thank
with
you,
you.
John.